Welcome to Check Up with Bluegrass, the official podcast of Bluegrass Community Hospital. I'm your host, Cliff Wilson, Market President for LifePoint Central Kentucky. Each month, we will sit down with our trusted providers and healthcare leaders to talk about the topics that matter most to you and your family. Today, we're focusing on preventative care, how staying ahead of health problems can lead to a better, longer, and healthier life. From regular checkups to workplace wellness, there's a lot we can all be doing to stay well. I'm so excited to be joined today by two incredible guests, Emily Spencer, certified PA, who sees patients right here in Versailles at Versailles Internal Medicine, and Matt Wing, who leads our business health program at Bluegrass. Emily, Matt, welcome to the show.
Thank you.
Thanks for having us.
All right, we're going to start with Emily. Let's just go right to the basics, Emily. What exactly is preventative care and why is it so important?
So basically, preventative care is an area of healthcare where we try to identify potential health risks that could potentially lead to more serious health conditions or chronic disease. It's important because early detection is how we prevent those chronic diseases, those more serious illnesses, and that overall lowers healthcare costs. It leads to better overall health longevity. So preventative care is where internal medicine really specializes with patient care.
Very good. So what are some of the most common preventative screenings or services that you provide in the clinic?
Yeah, so with us being an internal medicine office, probably the most common thing we do for preventative care would be our annual physical exams. And at those exams, that's where you would get routine lab work. It's where we touch base with patients and make sure they are getting those recommended screenings that they have in place for people. We also do blood pressure checks and a fairly thorough physical exam, which might even include an EKG at that appointment. So that's commonly what we see.
Very good. And at what age would you recommend that patients start seeing a provider for an annual wellness visit?
Sure. We usually do a yearly annual starting around age 30, but we see all adult medicine, so starting at age 18. For those types of individuals, 18 to 30, we recommend every couple of years coming in, checking in, making sure things are doing well. Just because you're feeling well doesn't mean that there's not something going on. So we do recommend that 18 and older get in every couple of years, yeah.
Okay. And what kinds of health issues can be detected early through just routine screenings?
Yeah, so I think when people think early detection, the first thing that comes to mind is probably cancer screenings. And so those are vital in finding, breast cancer, lung cancer, cervical, prostate, colorectal cancer. But also these early screenings can detect high blood pressure or chronic kidney disease or the potential for diabetes. So all of those are included in that preventative screening.
Okay. Emily, how do you approach helping patients manage chronic conditions like diabetes or high blood pressure?
Yeah, so I think when you're starting and you get diagnosed with one of these chronic disease states, you have to build a rapport with your provider. That means regular office visits, that means regular routine blood work. We do a lot of lifestyle modification, educating patients on how to take control and manage their disease along with their provider.
Okay. There's probably some folks out there that maybe have not seen a provider in a long time, maybe several years. What would you say to someone like that might be a little nervous about making that first step to go see you?
Yeah, sure. I think the apprehension probably lies in nobody wants to get bad news, right? And so if they don't come in, they don't hear any bad news. I think the biggest thing is just getting your foot in the door the first time. We have a very relaxed office. We approach patients even if they haven't been in a while. We go through what these preventative screenings look like, and we try to make them as comfortable as possible. I think people, once they realize that it's a relaxed environment, they're not so apprehensive to come back. So
very good. And How do you work with patients to build a plan that fits their lifestyle, individual goals, and their schedule for that matter?
Right, and most of that includes getting them into the office. And so we sit down, we talk about what they can do lifestyle modification wise. I think people have to take a little bit of accountability too. We're there to provide and make the recommendations of what should be done. But they also need to know that it's going to take some work on their part as well.
So we always want to know what are some of the new guidelines. So are there any new updates or guidelines around preventative care that people may not know about?
Yeah, sure. I think probably the one that most people are talking about currently is they've lowered the age of colorectal screening to 45. Most people think screening colon happens at 50.
Yes.
The American Cancer Society several years ago lowered that age to 45 because we are seeing some of those colorectal cancers in even people in their late 30s, early 40s. Some of the other things are they've spaced the routine screening for pap smears out to every 3 to 5 years. So those are some of the most recent changes. Everything else is pretty much standard.
Good. Thanks for sharing that. So how does mental health fit into the overall picture of preventative care?
Right. So one of the things about getting, getting people into the office would be we do an anxiety depression screening on most of our visits, and so that helps us kind of identify early on where mental health might be an issue, and it does affect overall health. So it's important to maybe bring that up in an office visit where people maybe wouldn't be as comfortable bringing it up on their own. We do it on our end.
Very good. So Emily, and I used to fall in this category, what is your message to younger adults who feel they're healthy? I may not need to see a provider. What's the message to those folks on the importance of getting established with a primary care provider?
Right. I think that's pretty common in younger adults, especially late teens, early 20s. They feel good. They suspect nothing is going on. But when we do those routine preventative screenings, we may find that their blood pressure is a little elevated, that they're drinking too many energy drinks, or they may have developed some kidney disease or something like that. So just because you feel good doesn't mean that there might not be an underlying issue. So I think establishing a good relationship with your primary care provider early on just proves that going forward, you're going to have that relationship and you're going to get those routine screenings.
Yeah, I couldn't agree more. Emily, thanks for sharing all that. We're going to switch right now. I'm super excited to talk to Matt Wing, again, our business health manager at our location here at Bluegrass Community Hospital. So Matt, could you give us an overview of what business health is and how it serves the community?
Absolutely. Bluegrass Business Health will encompass anything from occupational or industrial medicine. We try to focus on the needs for the local community revolving around employee safety and wellness.
Very good. So again, think about preventative medicine. What are some of the preventative services that you offer to local employers and their employees?
We can do anything from employee health screenings, pre-employment physicals, vision screenings, lab work, drug screening, respiratory fit testing, a lot of things that the environment that they're around, whether or not it could cause hearing loss, breathing issues, we can help prevent a lot of those problems from starting.
Very good. And why, Matt, why is it important for businesses to make the investment in the health of their workforce?
Well, employee safety and wellness should be one of the top priorities of what they're focusing on. If your employees are healthy, the area and the environment is safe, productive, productivity will increase, morale will increase. Mm-hmm. People are happy to be back at work. They know that it's a safe environment, a welcoming environment. So we try to focus on a lot of those areas.
Matt, so a lot of folks are probably thinking, well, if I need these services or I'm interested in these services, I've got to send my employees to the campus here, to the clinic. But you offer a lot of on-site services. Could you give us an overview of the services that Bluegrass Business Health provides at the employer's location?
Absolutely. We can do anything from DOT drug screening. We can do audio testing, breath alcohol testing, fit testing for respirators, We can do spirometry testing to make sure that they don't have previous lung issues that can come into play. We can do immunizations on site. We can do TB skin testing. 99% of our testing we can do on site for the companies.
That's a great benefit. Thank you for sharing that, Matt. As we think about the services that you provide, how do they provide that benefit both to the employee and the employer?
One of our goals at Bluegrass Business Health is that we want to offer the employees and the employers prompt, conservative, and effective medical care. We want to make sure that we're playing a role in their wellness so that we can save the employer and employee cost and time at the end of the year so that they can stay at work.
Very good. So, Matt, what types of businesses or industries do you typically work with in Woodford County and the surrounding area?
We service anything from a hospital level to first responders, fire, the sheriff's department, the schools, or any of the local restaurants or companies that are around. We can cover any area that's out there.
So you work with large businesses and small businesses as well.
Large to small.
Very good. And what does that process look like? If I'm a business owner out there listening to this show today, what is the process for someone that wants to get started with Bluegrass Business Health?
It's as simple as just calling the office saying, I have an employee I need seen. This is what I need them seen for. It's as simple as that. There's no contracts required. There's
That's
no
great.
long-term obligations to it. It's as simple as a phone call.
That's great. So how do you tailor the health and wellness program to meet the unique needs of different employers?
Typically, what we would do first is we would meet with the company or the employer and talk about the needs that they have, the areas that they're needing our assistance, whether or not it's visual to check their facility for areas that employees could be injured at, or what they need for screenings, wellness, different labs, different testing, whether or not it be lift testing, muscle testing, and we cater their plan specifically to each company so that their needs are met.
Very good. Matt, are there any seasonal services or high demand times of the year for workplace health support?
Yes, fall is definitely a busier time. We will get into a lot of annual screenings for different companies, and we also do flu clinics and on-sites for those. We will come on site and make sure that any of the employees that are willing or wanting to have a flu vaccination, we'll provide those for them.
What a great resource. So what would you say to a business owner who's never partnered with a healthcare provider before?
Our main mission for Bluegrass Business Health is we want to deliver some of the best medical care while assisting in controlling workers' compensation costs, specific to pre- and post-employment screenings, and we want to make sure that it's prompt and conservative treatment for any of the injured workers so they can return early to work.
Very good. Thank you, Matt. So to Matt and Emily, before we wrap up, is there anything else that you'd like to share with our listeners about staying proactive with their health?
From my standpoint, I believe that preventative medicine is one of the best ways to enforce and encourage a healthy environment for your employees.
Yeah, I couldn't agree more. It's important to get those early detections just for overall well-being, and it keeps people healthy and happy.
Very true. So you both have provided a wealth of information today. How can people get in touch with you if they're interested in scheduling an appointment or learning more about the services provided?
For our services, anybody can reach out on the Bluegrass Business Health website, and all of the contact information for all 4 clinic locations are on there. And if not, anybody can feel free to email me directly. My email is going to be matthew.wing@lpnt.net.
Yeah, and appointments are available online. We have online scheduling for my clinic. That can be accessed through the Bluegrass Community Hospital website. It is Versailles Internal Medicine. I do encourage people, if they look on there and they don't see availability online, to call my office. We have spots on my schedule that we can usually accommodate people within a couple of days to establish care. And that number is 859 879-2465.
Very good. Well, thank you both for your time today and all the work that you're doing to keep our community healthy. And to our listeners, thank you for tuning in to another episode of Check Up with the Bluegrass. Until next time, take care of yourself, take care of each other, and don't forget, your health starts with prevention.